demonstrate a little bit about the upper body. For those of you who are ready, and remember, you don't go to the upper body until one of us tells you you're ready. So this is a pretty good rat in terms of the blood vessels of the head and neck region. As you know, not all of you have animals that are that nice. It all depends on how well injected the animal was. But we want to keep these blood vessels, obviously. This is your external jugular, internal and external facials. And this one here going over the shoulder is the transverse scapula. Here's our sternohyoids. You remember those from your last practical? You stick your scissors between them and gently part them. You're going to fray them, but we don't care.
You move, and then I move.
Okay, I thought you wanted me to go over here.
It's just the head.
And as we start to part those muscles, we can see part of the respiratory tract. Right there is the trachea. And you can actually feel the tracheal rings when you rub your scissors on it. And then right below the jaw, we'll see where the trachea becomes looks like a solid, almost like a bullet, and that's the larynx. So here we can see the tracheal rings. There's our larynx, cricoid and thyroid cartilages, but I wouldn't worry too much about that detail for the practical lecture exam, yeah. And I'm lifting up on the sternohyoid to just cut it off. We'll do that on both sides, being very careful not to damage those blood vessels. Yeah, this side's not quite as good because I can't,
Yeah.
the light's not working for me to see things. So I'm gonna just come back over here again. So what we're gonna do is go through the chest. I'm gonna do it differently than it is in the book, because normally what I want you to do is come in here where the armpit is, but most of you are gonna have a real hard time getting these scissors into that little tiny opening. But the chest muscles are in the way, and this is going to tick you off because we're going to cut them off. And we're going to pick them up, the pectoralis profundus first, and then the superficialis. And notice I'm really close to the origin, working my way up towards the head. Instead of cutting right through here like you would think I would do, I'm working right along the origin. The reason for that is you can see the chest is A-shaped or triangular, unlike our blocky chest. So if you're going straight up, you'd probably slice through these blood vessels and nerves in the armpit, which are actually fairly important to us. So in fact, you can see those nice white nerves. They look like spaghetti that hasn't been broken by somebody's roommate. I come up here, just part that. Now we can see the external jugular coming out of the chest, right? And we can see some of these armpits, blood vessels that we're going to worry about later. And a few tiny branches, unfortunately, we're going to have to sacrifice as we go because we're opening up the entire chest. So we'll do that on both sides. And really the main reason why we're doing this is to make it easier to cut through the rib cage. Your scissors are going to have a hard enough time cutting through the rib cage. Having muscle on top is just going to make it harder. I'll just cut that off just so it's out of the way. All right, so get this one too. At least a bit of it so you can see where you're going. So what we're going to do is come right here. This is the manubrium, right down the midline. We don't want to go through the manubrium, or the sternum for that matter, because it's all bone. So we move a little bit off to the side so we can get into the costal cartilages. At least those you have an easy time cutting through. Now the problem is the lungs and everything are right up against the rib cage. So as I'm going in here, I'm lifting up with the time. So I'm right up against those costal cartilages, and I'm less likely to cut into the organs. All right, so you really can't get a feel for this looking at it, but I'm really pulling everything up as I go. We're going to come down, not all the way down, because we want to leave our diaphragm. We're going to come part way down, and then we're going to take our scissors and go through the intercostal muscles, following the curve of the rib, just because it comes out looking better that way. Right and we're gonna move backwards. Now, I'll notice as I do this that I could use one less rib in my way, so I'll come down here just a little further. We can begin to see a little bit of the lungs and all that as I pull this back. I gotta be careful here, because there's the blood vessel leaving. So, we take our scissors, whoops, and we poke them in here above the blood vessel, expand it. You can begin to see things a little better now. There we go. And then we just go through and we cut the ribs off. All right, so then we go through the sternum, and if you're lucky, you'll be right between two sternum, so it's an easier cut. If not, it'll take a little more effort. Follow the curve of the rib down the other side, and do the same thing, right? Come up on the other side. Keep on pulling on the rib cage as you go. And you'll hear the little ribs being cut as you go. Not a big deal. Sounds a little bit like clipping toenails. If you haven't done it in like 6 to 8 months. Okay. Still have a little work to do here, obviously, but now we can take a look in here and see what we've got. And this brown thing, along with all the other brown things, is the thymus. And it's nice and healthy looking. It's brown and lobulated. That shows this was a young animal, but we knew that. We knew that all of these rats were about your age, equivalent. Just finished going through the final maturation stages, young adults, everything's still looking pretty healthy here. That's the one disadvantage to working with these rats, or one disadvantage, is that they're all the same age, so you don't see a lot of variation. We're going to take that thymus off, just using our little separating technique again, so we can see the underlying blood vessels, which we want to clean up and show, obviously. So we just come in here, see how I'm opening that up just like you did in the lower body, breaking things apart. There we can see the carotid artery next to the trachea. And you'll see a little white thing underneath that. That's the vagus nerve, which is kind of neat to think you could find a nerve. All right, so a lot of times in here, you're going to find that. You might find some congealed blood in here. All right, that happens, unfortunately. So, I know some of you have been to Disney, and this might be shocking, but this is the heart of the rat. And we have our little right auricle and nice blue left auricle here. These are outpocketings of the right and left atria, respectively. Here we see the apex of the heart. This serous membrane here is the pericardium. Here we see the post cava coming down, which you want to clean up a little bit. Here we see the post-caval lobe of the right lung. And of course here we can see the right posterior, right middle, and right anterior lobes. And on the left side, we just have one big lobe, which is right there, which is basically the left lung. If I pull on this, you can see, I don't know how well you can see it because I'm not sure what the magnification effect is, but you can see some little white things running across there. Those are the bronchi, which we'll talk about in lecture tomorrow, actually. All right, so you got a bit of cleaning to do here. You want to break all this fat away so we can trace out these blood vessels and nerves. And we can see a little bit of that there. This large vessel we're seeing here is one that humans don't have. Humans have one large vein bringing all of the blood cranial to the heart to the right atrium. It's called the superior vena cava. But rats and many other mammals have two veins called the precava, right and left precava. So we have two here. And then we'll be able to follow this through how it branches up to give us the brachiocephalic, external jugular, one branch going under the clavicle called subclavian, which will come out through here and become the axillary in the armpit. We'll trace out onto the arm, separating these muscles eventually to show the one on the arm, which will be the brachial. Okay, so that's really all you're going to be doing here. It's just going to be really patient as you go. And just like lower body, you work one side at a time, so if you make a mistake, you learn from it. All right? Any questions? And later on, for those of you who haven't been in a relationship, I'll show you how to cut open a heart.